Before you reach for that bacon with your breakfast, you might want to think again.
A lot of people are going to be happy about this. Dr. Julie Chen, an internal medicine doctor at Kaiser Permanente, is joining us now to talk about how these processed foods can really affect our health. Good morning, Dr. Chen.
Good morning, Tim and Amy.
So, yes, we do love bacon. It's processed foods. Along with other processed foods, what should we need to know about that food category? How much should we be eating? How much should we not be eating?
Definitely. Well, first of all, ultra-processed foods are foods that have been heavily altered and contain ingredients you would not normally find in your home kitchen, such as emulsifiers, preservatives, and other additives. And oftentimes these tend to be higher in sodium, in sugar, and saturated fats, while being lower in healthy ingredients like fiber and protein. Kaiser Permanente experts note that these foods can shift the body toward more inflammation, and the more inflammation your body sustains, the higher your risk of cardiovascular disease. So in summary, if you eat more of these ultra-processed foods, your body's at much higher risk of things like stroke and heart attack.
Oh boy. Well, you did single out bacon, but you've talked about other things. So is it no bacon, none of these other things, or is it moderation? What is your suggestion?
Well, definitely we don't want to aim for perfection because that oftentimes ends in frustration and failure. We want to advise our patients that a diet that is healthy includes things like lots of fruits, vegetables, nuts, legumes, and whole grains. And the more you can ingest those types of foods first, the more satisfied your body will be. So it's making these small choices consistently along the way that really makes the biggest difference for heart health over time.
And I know you mentioned ultra-processed foods and the variety of health factors and risks that come along with it, but are there ways that we can, like certain signs they can look out for if you're like, oh no, I'm eating too much of this or something, or maybe too much sodium? What are some of those signs we can look out for?
Yeah, that's a great question. One thing to note is that oftentimes these diseases occur silently. So really trying to be careful about ingesting ultra-processed foods early on is the best idea, because people may not have a lot of symptoms early on, but be suffering things like high cholesterol and high blood pressure, and slowly begin to develop weight gain, diabetes, and really serious heart problems over time. However, once the problems have taken effect, some signs that people may notice are things like swelling of the legs, shortness of breath, fatigue, even pressure in their chest if things are getting more serious. So it's best if someone has any particular risk factors, including a family history, to actually see a doctor earlier on and get all the preventive screenings so that one can be more aware of their risk.
Yeah, always great suggestions, Dr. Chen. Where do folks go to find information, more information?
We have a lot of information on our website at kaiserpermanentekp.org, where we practice holistic healthcare, and really a lot of great information on lifestyle medicine and nutrition and seeing your primary care doctor to ensure that you stay healthy.
Dr. Julie Chen, thank you so much, as always. Appreciate your time.
Thank you.